Thank you so much, Shelley. Thank you everyone for attending today. My name is Dr. Veronica Peniotu, and I am the Advocacy and Program Manager here at NCCS. It is my honor to introduce you to our Elevate ambassadors here at NCCS. The Elevating Survivorship Program is an advocate-led initiative to improve survivorship care in the United States. It launched in 2018 to identify gaps in survivorship care and deploy cancer survivors, caregivers, and survivorship healthcare professionals to fill those gaps in communities. So the next two panels will be our ambassadors from the 2022 cohort, and I am thrilled that they are here to share their work with you. And I hope that they inspire you to implement survivorship programming in your community. Our first session will focus on implementing health equity in your community. Dr. Lockhart will take it from here.
Thank you, Veronica, and thank you, NCCS, for having us and allowing us to be the Elevate ambassadors. We have really enjoyed our programming with you guys, and we're excited that you are all here to hear a little bit about how we use the health equity lens in our project. So, Arti, if you can give me the next slide. As Veronica said, my name is Jala Lockhart, and I'm coming to you by way of Atlanta, Georgia today. We also have Dr. Arti Varanasi with us today, and she's coming to you by way of Maryland. We also have Ms. Roxanne Berger coming to you by way of New Jersey. And then finally, we have Nicole Drost, a very passionate advocate and survivor herself, coming to you by way of New York. And again, we are excited to share with you all. So before we get started today, we thought it important to really lay the groundwork and maybe provide some definitions for some of the context that we're going to be talking about today. So I always want to provide the definition for what we term a survivor. And so on the screen, we have NCCS's definition, stating that a survivor is someone from the time of diagnosis through the end of life. And so we also want to make note that a survivor is not just the person who's diagnosed, but everybody in their social circle. So whether it be their family, their friends, or their caregiver, NCCS is very focused on making sure we're providing the resources for all of and the advocacy for all of those involved. Again, the panel today will focus particularly on how we use the health equity lens in our project. So we wanted to provide this definition to help kick us off. And this definition comes directly from the National Cancer Institute, which states that health equity is a situation in which all people are given a chance to live healthy life as possible. And this is regardless of some of the social demographic factors, the disabilities, maybe social economic context, language, and lots of other factors. And so we recognize this definition because it also points out that when we don't have health equity in some of the things that we're talking about, whether it's policy, projects, community, we see health disparities and differences in health that can relate into things such as severity of disease, disability, and death. And so we just wanted to provide those definitions to provide a groundwork for our conversation today.
Thank you, Jala, for providing that perspective and insight into health equity. And I'm really excited today to share the stage and would love to walk through this example of equality and equity. So a lot of times when we think of equity, individuals' minds immediately go to equality, which is providing the same resource tool for everyone. So in this example, you see a picture here of a bicycle and different individuals with different abilities and their ability to ride that particular bicycle in the top frame. It's the same bicycle for everybody, but it doesn't work for everybody, right? And so when we talk about equity, it's really both a process and an outcome. And how do we meet people where they are so that they can have the best possible health outcomes and outcomes overall and a quality of life, right? So if you look in the bottom panel, when we're thinking of equity, it's a different type of bicycle for everyone. So there are different tools and resources. So as we move through our panel today and hear the stories from our Elevate ambassadors, I want you to keep this image in mind. And so with that, I'm going to open it up. I'm going to stop sharing so you can see all of our wonderful ambassadors fully, and you'll be able to hear each of their stories. So the first question we have for our 4 ambassadors that are here is, what motivated you to address the survivorship needs in your community through a health equity lens, and how did you do this? So as each of you speak, can you just share a little bit about that and a little bit about the program that you built as this past year as an Elevate ambassador? So Roxanne, we'll start off with you, coming to us from New Jersey today, and then we'll go to Nicole, Jala, and then I'll wrap it up and ask another question.
Good afternoon, everyone. My name is Roxanne Berger, and I'm the clinical nurse coordinator for the survivorship program at MD Anderson Cancer Center at Cooper in Camden, New Jersey. Just a little bit about my project and what I do. I help develop programs that address the needs of our cancer patients at MD Anderson at Cooper. And through this process, as a nurse, I saw that there was a need in our community. I work in an urban center, and the dire statistics for African Americans and other people of color in not only their survival rate, but the increased incidence of cancer and the hardships that it poses on their lives, that I wanted to find a way to address that. So a key motivating factor was I was not only a nurse, but I became a caregiver. My father had prostate cancer, a 76-year-old gentleman who was very lively, who didn't take any medications, who ran his own business but had difficulty navigating a very complex healthcare system, along with other relatives. My faith is a big part of who I am, and one of the reasons why I became a nurse. All of those different factors, I looked at my community and the need that they had, especially cancer survivors and follow-up. It wasn't consistent. So I developed what's called the Hats Off program, and it is healthcare advocacy throughout survivorship, ongoing focused follow-up. It's important that cancer survivors, once they are out of their active treatment, but they're in post-treatment, they have consistent follow-up with their providers in order not only for observation and surveillance, but just so that the development of late and long-term symptom management is important, learning to be an advocate for themselves, talking about decisions, thinking about decisions that affect their health and their spiritual well-being. So I'm teaming up with faith-based organizations, because in the Black community, faith-based churches are an important component of our community.
Thank you, Roxanne. Yeah, I see some threads of overlap here, and thank you for sharing your story. So Nicole, can you share a little bit more about your program and your motivations?
I can. I have a background in education. So as I was going through treatment, I remember thinking I want to be able to help other people that are in the same boat as myself. I was diagnosed at 40. I was a mom with young kids, and this is educating other people, kind of my jam. It motivated me to start a support blog for cancer patients, thrivers, survivors, and their caregivers. I'm actually doing a cancer walk this weekend where I'll be able to network with other cancer patients. Very excited about that. I love meeting new people. I love to share my story and others. And I think a big factor when thinking about what I wanted to focus on for was age, because I was diagnosed at such a younger age with endometrial cancer, which mostly occurs in women who are postmenopausal in their 50s, 60s, and 70s. And are a big thing because I did not click any of the boxes for endometrial cancer factors. I had symptoms, but not being, for lack of better, educated enough, I put all my trust in my OBGYN, which was probably my first mistake. So being the researcher, educator that I am, I, looked on Google trying to figure out what was, going on personally. But every time I go into, the doctor's office for a checkup, or I'm out in my community and I see other people struggling with cancer, I go right up to them, have a discussion, we chat. I tell them I've been there because, you wouldn't wish this experience on anyone. But NCCS has allowed me to network with other people such as yourselves on here. It's given more of a voice for me in terms of possible medical gaslighting that happens sometimes with women when, they know something's wrong. Sometimes it's chalked up to anxiety. And I'm hoping to change that a little bit in my community. So women are taken more seriously.
Thank you,
And
Nicole.
oh,
sorry.
that's
Go
it.
ahead. I thought you were done. Please
I'm
go ahead.
sorry. Now, in the community that I live in, there's the African American community seems to lack in getting diagnosed at early stages for gynecologic cancers. And my hope is that I can make a difference in their community. My goal is just to get more support group. Surely it's getting some steam.
Thank you, Nicole. And both of you, both Roxanne and Nicole, have addressed two key areas in advancing health equity and highlighting inequities around, seeing cancers in individuals of color, especially African Americans and Black individuals, and then also younger individuals. So with that, I'd love to turn it over to Dr. Lockhart, because her project came at all of this and looking at cancer health equity through that lens in a little different way.
Yes, you were picking my brain. That's exactly what I was going to start with. And I would say, similar to Nicole, having a background in health education, I was very interested to know for my project, what are the cancer centers doing about these disparities? So we know they're out there, the patients are voices. How can cancer centers kind of respond to this need? And so my Elevate project was my dissertation, actually. And the first part is where I used a secondary data set to look at some of the maybe differences that occur between health literacy of patients. And so you'll remember from the definition I shared, language is actually a place where we can influence health equity. So I looked at health literacy and also patient-centered communications. How are survivors rating their interactions with patients? From there, the second part of my dissertation, I wanted to also look at, okay, we know that there are probably some differences between patients' health literacy and their reported patient-centered communication. What are cancer centers doing about this? So I specifically searched all the National Cancer Institute cancer centers, all of their websites, for a question prompt list to see if we're doing anything to meet these needs. Are we providing resources that would help a patient communicate better with their provider, whether it's cancer specific, age specific, race specific? And so I found a lot of data that says we can improve there from a health equity standpoint and the resources that we're providing.
Yeah, awesome. And keep an eye on Dr. Lockhart, because she's just starting, right? And I think, we all, as Nicole mentioned, kind of go to Google, see what's out there, right? And what we've come to find is that sometimes all the information is there, right? So each of our projects have kind of highlighted getting the information to our communities. And so my project, just a little bit about it was focused on helping to better understand the psychosocial needs of diverse cancer patients, and then being able to provide them those resources and leveraging technology to do so. Right now, our And this actually dovetails into my next question. Our project got off to a slow start. Part of our goal was to recruit women from the community to help us in co-designing our solution. And the recruitment was harder than we expected. So I'm excited to share that we've now had 3 interviews and have a few more to go, but we'll be, continuing the foundation that was set during the Elevate project and moving beyond that with really the goal of being able to be equitable in providing that psychosocial support, because it's needed throughout the cyber survivorship process, from diagnosis into treatment and beyond. And so with that, I'd love to hear from our my fellow panelists some of the maybe challenges that you found in addressing health equity needs in your community. And as I mentioned, we had to kind of pivot our program. Did you have to pivot at all as you started down that road, and what did you discover? So we'll keep the same order. So Roxanne, would you like to share, please?
For me, one of the challenges was, especially among older African Americans, is trust and privacy. They don't want to talk about it. So when I was reaching out to faith-based organizations, they didn't quite know how many of their members had had cancer or where they were at in the continuum of care. So I found that difficult, and it kind of changed the trajectory of my project a little bit. And trust. Trust, like, well, who are you and why are you doing this and what's your motivation for that? So gaining trust with the community, gaining trust with those in leadership at churches, that I'm here to benefit their congregation, to help them to live a healthier life, not only physically but spiritually. And it was very hard to gauge how many of those survivors that I could be impacted by my program. And the last and biggest challenge, and it was more on my end, was getting the information out there about my program and being able to do it in an effective manner.
Thank you, Roxanne. You touched on a lot of key points I think we've talked about as ambassadors, and I think getting the information out there is always a challenge, right? Like, how do you disseminate? And sometimes we think that everybody's on a certain platform or is going to engage in a certain way, but you realize that different people access information in different ways. So really kind of looking at that to meet the needs of your community. So thank you for sharing. Nicole, how about you? What are some of the challenges you saw, and through your program, did you have to pivot? What were some of your discoveries?
I didn't have to pivot too much. One challenge I found was that because I was a young woman with endometrial cancer, one of the big things was I felt like there was not enough support as a young gynecological cancer patient. There weren't a lot of support groups out there for gynecologic cancer. I looked into my community. We have Breast Cancer Coalition, which meets. I tried those support groups out, but it was really hard to find a feeling of inclusivity. I didn't feel like I fit anywhere for a while. Ironically, I ended up finding a support group on Facebook where I felt like I fit in. However, I'm happy to share that because I've been networking, which NCCS has been so wonderful regarding that. They're going to be doing more gynecologic forums and support groups at the Breast Cancer Coalition of Rochester. So I'm very excited to be involved in that, because I told we need support. I was a mom with young kids, and I think that in order to get better physically, feel better mentally, emotionally, it is so crucial to feel that kind of support. And not feeling where you fit in can be hard, especially when you're going through treatment, even for caregivers, I think. But that was the big challenge, I'd say, as far as my project and my experience goes.
Thank you for sharing that, Nicole. And as you were speaking, I thought it wasn't going to be, you wouldn't let that be the situation for long, where people like yourself couldn't find a community. So you've already changed the mold. And I think, you brought up a very important point of the inclusivity, right? I think going through cancer, it's often, you can feel very lonely. So being able to have a community that you can identify with and feel welcome in. And I think, I don't want to necessarily speak for all of us, but just having been around you all, I feel like I can say this, that NCCS, provides that community in many ways. And the community may be where you live, but it also could be a virtual community, as you noted. So I think that's really important to keep in mind. And, with all the tools and technology we have at our fingertips, we can build that virtual community. So, and I know Jala
Totally
has
agree.
stories of pivoting for us. So I'll turn it over to you and to kind of share your journey in that respect.
Yes. So in the sense of being able to do a dissertation for my project and using a secondary data set, all of the information I needed was basically handed to me or given to me. I was able to access it. And so you might think, how would you use health equity lens, or how do you approach health equity from data that's given to you, or something that I didn't collect, or I'm not boots on the ground. But I wanted to ensure that when I was running my data, I was very respectful and thinking of who I was doing this research on and for, making sure to call out some of those things in publication. One of the big things I was able to do to actually influence health equity with the data I had was to run some of the statistics from an intersection. Well, if you're familiar, intersectionality is a theory. And this basically states that we are not just male or female. We are not just, young or old. We are a young adult female, or we are an older adult male. And so being able to run some of my statistics that way let me see what is the health literacy and patient-centered communication for somebody who might identify as an African American male. And that's where I found a lot of my differences, in the sense of not just looking at males, but how might health literacy differ between males who are Black versus males who identify as Asian American or something like that. And so I definitely encourage anybody who does have access to data or statistics to think about it in that way. And then also, finally, one of the ways that I wanted to pivot or just make sure that I addressed health equity in my dissertation was calling out the fact that this data is not submitted in that type of way. We typically don't see some of those demographics ran together, and also challenging the things that were missing in the data set. So unfortunately, I did not have access to what is the religion of this person. Do they identify as LGBTQIA in some sorts? And some of those things, in survey data, you don't get access to because we're not allowed to identify anybody. But I did call out the fact that having some of that data would also help me kind of make a more robust statement about why we need equity for different groups of people when it comes to health literacy and health communication.
Thank you, Jala. And I think, the intersectionality is so important. And Roxanne touched on this too, that the data piece, right? Like who's being represented in the data set, who is missing, right? So, a lot of times data is not collected completely on every individual. So we need to understand that and understand who's, in our community. And I think when I look at our project over this past year, part of, our challenge and where our pivot is looking for trusted partners in the community, right? And allies, and those that would be able to kind of bridge those I don't want to necessarily call them insecurities, but just feelings of like, can I trust this person or that, right? So, if I'm alongside a trusted member of the community, then individuals are more likely to engage with me and know that, especially, ours was, we approached it as kind of a research project, and there's a lot of mistrust around research in many communities. So how do we explain and kind of bridge that and show and be transparent? I think somebody else mentioned transparency earlier, right? With the information, and then share back about what we're doing. So I would love to, we have about 3 minutes left. So I'd like to just do a quick round robin with each of you and share, because we have, looks like over 100 people on the call today, which is very exciting. And to share what advice you have for our fellow advocates who are looking to build programs in their communities, and especially do it through a health equity lens. So Roxanne, if you'd like to kick us off, we'll then go to Nicole and Jala, and then I'll wrap up.
Really quickly, NCCS has been a big part. I have been on their site. I've used it to help me develop my program. One quick thing is collaborating with partners in the community. It's a big thing. For those that are starting from the ground up, I suggest meeting with your local borough. I went to my borough meetings and I voiced my concerns about the health of our citizens of Lindenwold and the dire statistics that my certain community had. And I kept voicing them and voicing them. And now I have relationships with the president of our borough council. I'm working with several churches. I've made connections now with other nonprofits in the in my neighborhood, in my community, and just reach out, make connections. I think it's important to make those connections and then stay true to your passion.
Absolutely. I love that. Staying true to your passion. Nicole, what about you? Advice.
Well, I can piggyback on what Roxanne said. Take your time. One thing that I discovered is you can't rush meeting new people, collaborating with new people. I would just your time, collaborate, network with other people. I can't tell you how many times I've contacted someone in our cohort who, was able to answer a question or send me a link on how to, already had sent me a link on how to make a QR code because they didn't know how to do it. Just collaborating with other people in your community, like Roxanne had said. Take your time. Well, take notes, enjoy it, because I've actually learned a lot.
Mm-hmm.
Thank you, Nicole.
About how I want to help others as well.
Absolutely. And I think enjoying it is key too. And, and so Jala, on to you. What's your advice?
Yes. Rapid fire, it's just don't give up, because more than likely you might be the only one doing it, or it's going to take a long time to get it up off the ground, like they said. But without your work and what you're doing, and if you're not passionate about it, it won't get done. So don't give up, keep the fight, and don't ever give up.
Absolutely. And so I agree with all these ladies, and we're at time. So I have final words for everybody on here is to be bold and be brave and put yourself out there, right? Because there's a need, and don't wait for others to do it. Go out there and do it. And know that you have the support of a whole community behind you, as everybody has mentioned here. So I want to thank Roxanne, Nicole, and Jala, my fellow 2022 Elevate ambassadors. And now it's time to hear from a few more from our cohort. So it is my pleasure to turn it over to Shelly Fulnasso, who's going to introduce the next panel and moderate that panel. So thank you, everyone, and stay engaged. And later you have the opportunity to hear more about networking too. So take care.